dermal fillers are substances that come in pre-filled syringes. They are manufactured in highly sophisticated labs. And the purpose of dermal fillers is to be injected in the skin in different areas where volume loss has resulted either from aging or sometimes even from trauma or scarring or disease like HIV, which cause HIV medications, which cause depressions. So dermal fillers are injected. They come in pre-filled sterile syringes and they're injected where they are needed. The most common dermal fillers and the safest dermal fillers are hyaluronic acid based dermal fillers. So they are manufactured from hyaluronic acid, which is a substance that is naturally found in our skin, and it gives it volume and shape. So when hyaluronic acid is missing and volume is missing from the skin, it is injected in those areas to repair and restore the volume and the natural look to the skin. There are other types of dermal fillers, for example, calcium-based fillers, something we call calcium hydroxyapatite. They also come in pre-filled syringes. And again, it is the doctor's choice to choose which type of filler to inject. The most common, as I said, are hyaluronic acid-based fillers. Dermal fillers are administered by injecting them in certain areas of the skin. We need to choose the concentration of dermal fillers. For instance, when I'm injecting hyaluronic acid, it comes in light concentrations up to heavy concentrations. And each area requires a different concentration of dermal fillers. And each area, when the dermal filler is injected in the skin, has to be administered and injected at a certain level of the skin to maintain the beauty, the natural appearance, to prevent the occurrence of lumps or asymmetry, and to restore the balance to the face, as well as any other area where it is injected. If used properly by professional doctors trained in the anatomy of the face, who know which areas are safe to inject, which areas are not, they know the danger zones in the skin, then hyaluronic acid fillers are safe, as well as other fillers like I mentioned, calcium hydroxyapatite and others. If they are administered by someone who is not a doctor and is not really well trained in the facial anatomy and is not very well experienced in dermal fillers, they can cause side effects that range from asymmetry, from lumps that are visible, causing an unnatural look, all the way to bruising and even occluding some arteries, leading to very severe side effects like blindness, which can be irreversible. So dermal fillers can be injected on the face, on the neck, on the hands to repair the volume loss and improve the wrinkling. And they can be injected on the body as well. In my practice, being a dermatologist, I mostly inject them on the face as well as the hands, but the most common area is the face. Now, on the face, they can be injected in different areas. For instance, under the eyes for hollowness. They can be injected on the nose to correct asymmetry and what we call the non-surgical nose job. They can be injected on the lips to restore volume, on the jaw lines, on the cheeks, on the lines between the jawline, between the cheek and the lips. They can be injected also on the temples. Basically, it's using dermal fillers and injecting dermal fillers is medicine mixed with art. It's like doing a sculpture, and it's not something to be taken lightly, and it is not for anyone to do. Yes, dermal fillers can be combined with different treatments, different procedures. As I tell my patients always, it's a combination treatment, and it's not one thing that fixes everything. So for instance, commonly dermal fillers are combined with botulinum toxin to erase the lines and smoothen the lines all over the face and restore the volume and the natural appearance to the face. They can also be combined with different techniques. For instance, there's a new treatment that's called PRP matrix, where the hyaluronic acid fillers are mixed with platelet-rich plasma in the same tube. And here the hyaluronic acid fillers are not used to restore volume, rather to repair the collagen and improve the texture of the skin. They can also be combined with many other treatments like microneedling, laser resurfacing, and many others. So it's always about the combination. So when I see patients, I assess their skin, I assess their face, and then I give them a detailed treatment program combining different treatments to achieve the ultimate result they are looking for. With dermal fillers, specifically targeting the face, the results are visible immediately. So on the spot, we can see the cheeks being lifted, the temples being lifted, the lips being filled, and under the eyes being repaired, the grooves lifting. So the results are immediate. The following day, especially around the lips, people get some swelling. So the area looks bigger than it actually is. And then within 24 to 48 hours, everything settles back to normal. Dermal fillers last roughly around 9 to 12 months. But in certain areas, for instance, under the eyes, they can last up to 2 years. And in other areas like the lips, because we use them a lot, they're very movable, so they can last less. So they can last around 4 months or sometimes 6 months. But the average duration of hyaluronic acid dermal fillers is about 1 year.